Why do lymphoma patients experience fevers? Imagine your body is like a busy city with many signals and responses happening all the time. When someone has lymphoma, a type of blood cancer that affects the lymphatic system, their body often responds with a fever. But why does this happen? Well, it mainly comes down to how the immune system reacts to the cancer cells and the biological activity within the tumor itself. Lymphoma cells can release special molecules called cytokines. These are like messengers that tell the immune system what's happening. Some of these cytokines include tumor necrosis factor, interleukin-2, and interleukin-6. These messengers can be produced directly by the lymphoma cells or by immune cells that are trying to fight the cancer. When these cytokines are released, they cause the body to react by raising its temperature, which results in a fever. This is part of the body's way of trying to fight off what it perceives as an infection or threat. But it's not just the cancer itself causing fevers. Because lymphoma can weaken the immune system, especially if treatments like chemotherapy are involved, patients become more vulnerable to infections. These infections can also lead to fevers. So, in some cases, the fever isn't just from the cancer but from an infection that takes hold because the immune defenses are lowered. Another reason for fever in lymphoma patients is tumor necrosis, which is when parts of the tumor die off. This process can release more cytokines and trigger inflammation throughout the body. In certain disorders related to lymphoma, like Castleman's disease, the overproduction of cytokines such as interleukin-6 can cause persistent fevers along with other systemic symptoms. To sum up, fevers in lymphoma patients are mainly caused by the body's immune response to the cancer through cytokine releases. They can also be due to infections that happen because the immune system is weakened, or from inflammation caused by tumor cell death. Recognizing that fever can be a sign of either the lymphoma activity or an infection is very important. If a lymphoma patient experiences a persistent or unexplained fever, it's essential to consult healthcare professionals. They can help determine the cause and decide on the best course of action. Remember, every person's situation is unique, and proper medical evaluation is key to managing symptoms safely and effectively.